This is TTT Live. I am DK Rostar. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Talk City 91.1 FM, Sweet 100.1 FM, Next 99.1 FM, and on Facebook at TTT Live Online. We go now to the Manager of Corporate Communications at the Ministry of Health, Candice Alcantara.
Good morning. Thank you for joining us this morning for another Ministry of Health virtual media conference, which provides an update on the Ministry's COVID-19 response. Here to update us on some of the COVID-19 developments, both here in Trinidad and Tobago and internationally, are Dr. Roshan Parisram, Chief Medical Officer, Dr. Hazel Othello, Director of Mental Health Unit, both of the Ministry of Health, and Dr. Joel Tilak Singh, Consultant Endocrinologist with the Southwest Regional Health Authority. I'm Candice Alcantara, Corporate Communication Manager at the Ministry of Health, your moderator this morning. We begin with the clinical update from Dr. Parisram.
Hi, thank you, Ms. Alcantara. Good morning to Dr. Othello. I'm Dr. Tilak Singh, members of the media, members of the viewing and listening public. So I'll go into the clinical update, and then I will go into a series of slides which will hopefully show what is happening in some of the counties in Trinidad and Tobago. So in terms of the media briefing, as of 13th of October 2020, 4 p.m., the total number of persons tested, 30,840. Total recovered patients, 3,367. Total number of active positives, 1,661. 93 deaths at present. Total number of positive cases since March 12th, 5,127. New cases reported in the last 24 hours, 11. Total hospital patients, 104. Those that stepped down, 41. Quarantine facilities, 42. And total persons in home isolation, 1,516. If we go into a little more detail with the hospitals, we look at 104 in the hospitals, as I said before. At the Couva Multi-Training Facility, 59. 4 of those are in ICU, 6 persons in the High Dependency Unit. Cora, 23 individuals. Arima, 3 persons at ICU. Augustus Long, no persons. Scarborough Regional Hospital at the Fort, 19. By way of our step-down facilities, 41 persons in total. At the Claxton Bay Correctional Facility, there are 27. At the UWI Day Bay Center, 12. And in Tobago, 2 persons. Lastly, in terms of quarantine, we have 42 persons in total. At the Chancellor Hotel, 1 person. Cascadia, 13. Regent Star, 19. And Day Bay Halls, 9. So I'll go into my first slide, which will give you an idea of the breakdown of the counties. We always speak about the counties in Trinidad and Tobago, but we never have spoken about the graphic in terms of population distribution as well. So this graph basically shows you the layout of the counties in Trinidad and Tobago. So if you start on the upper left corner with St. George West, then goes to St. George Central, St. George East, St. Andrew, St. David on the upper right, Caroni, Nariva Mayaro, Victoria, and St. Patrick, and then of course Tobago. It is color coded, so if you start with the light pink, in Nariva Mayaro on the bottom, it gives you the population in that particular area, so that is less than 50,000 in Nariva Mayaro. If you look at the geography of it and the actual mass, it is quite large for less than 50,000 people. And what it means by way of public health disease is that the population density is smaller in Nariva Mayaro, and it lends itself to less spread of communicable disease less quickly and usually in smaller amounts. And that is reflected when we see the graph in terms of the number of people that have been infected in that particular county being less than in the rest of the country. So St. Andrew, St. David, as well as Tobago, between 50 to 100,000 persons in those areas. Then we go into the browns. So the lighter brown, 100,000 to 200,000, we see, for instance, in St. Patrick and St. George Central. The medium brown, which will be in St. George West, St. George East, and Victoria counties, are between 200 and 250,000 persons. And the darkest brown, which is Caroni, shows 240,000 to 242,000 roughly people in that particular county, which is the most densely populated based on this particular map of 2010. If you go to my second graph, so this shows a breakdown of the active cases that we have spread across the country. And based on the map that I just showed you with the demography and the population densities, we can see Tobago at 3.5% of the country. Nariva Mayaro, the smallest, 2.1, and both of them, if you recall, were in light pink, meaning that they have less than 50,000 population. As we go forward, I won't go through all the counties, but we can see clearly that Caroni has a large amount, 164. St. George Central, again, a large 13.6%. And Victoria County, still being the largest, 21.9% in terms of number. Next slide. Home isolation of patients, which shows their clinical disposition. So new patients over the last period, which usually represents 24 hours, 1.6%. Recovery, 6.4%. Transferred to facility is 7.9%. Symptomatic at 29.2%. And our asymptomatic population that is being managed at home at this point, who would be deemed low risk, 54.9%. Next slide. So this gives an average of persons with comorbidities and without. In terms of those with comorbidities, we see 48.5%. Without, which is the green portion, they're 51.5%. So next slide. Right, so this breaks down our comorbidities, and Dr. Tiloxin will go into detail in terms of the types of comorbidities that we see and how that relates to the morbidity and mortality of disease. So I just wanted to put a breakdown again for Trinidad. Not St. George Central, St. Patrick, and St. David weren't included because the data sets at this point in time were not complete. So we look at diabetes, 23.2%, hypertension, 32.4% being the main drivers, asthma thereafter, and other. Asthma, 13.8%. Next slide. Just briefly again. It's very even now in terms of the distribution male to female, at least at the county level. 50.1% male, 49.9% female. Next slide. Again, just quickly, age distribution showing that the peaks are between 20 and 59 years of age in terms of the persons affected. Very low levels occurring actually below the level of 25 in general. This graph shows 0 to 19. And again, above 80, there's a smaller proportion. And it is a function of the age distribution of the population as well. And we see that the majority of persons affected are those who would be out and about working. Next slide. So this speaks particularly to St. George West. It gives a little different. I had shown Victoria in a previous press conference and County Caroni. So when we see again, we look at St. George West, new cases 2.5%, recoveries 4.2%, symptomatic 35.6%, asymptomatic 57.6%, which mirrors generally what is happening in the entire country. St. George West, again, next slide. There's a slight difference in terms of age relationship, which we have to look a little further to see why we have this difference. As you would have recalled, it's almost 50-50 nationally, but in St. George West County, seems to be predominantly female with 62.7% affected and males 37.3%. So there's a big difference there from the national picture in St. George West. St. George West, again, comorbidities breakdown. Next slide. So this shows basically, again, at a county level now, St. George West, what is happening in terms of the disease. The way the diseases are spread in that particular county will be, again, a function of the type of people that live in there. We see a difference, 15.7. If we could go back to the slide, please. Yeah, so for the previous one before, for St. George West. Yeah, so for St. George West, I'll go into St. George West. Diabetes was 15.7. We could leave Victoria, right? Hypertension, 41.2%. Asthma, 19.6%. And other, 15.7. So we see on the last slide that I have, I wanted to do a comparison of St. George West. And if we could go to the last one, which is Victoria. Last slide, please. Yep, so we can see there's a variance here. So if we compare St. George West, which again, based on the map, is in the upper northwest of the country, as opposed to Victoria County, we see Victoria having 28% diabetes as opposed to 15.7% seen in St. George West. Hypertension, 34.8%. In St. George West, we saw 41.2%. Asthma is only 6.8% in Victoria. However, in St. George West, it went up to 19.6%. So there are, between counties, there's variances in the comorbidities we are seeing. There's differences in the way the cases are spread in terms of demography. And of course, there'll be other variances that we'll pick up as time goes by. So, Ms. Alcantara, that's my clinical update for this morning.
Thank you very much, CMO, for that clarification and some additional information on some of the comorbidities. And we keep in line with this theme. We go to a presentation from Dr. Tilak Singh on some of the common NCDs or non-communicable diseases and how they interplay with COVID-19.
Thank you, moderator, and good morning to the panel, the members of the media, and our viewers and listeners. So as we've been battling this scourge of COVID-19, we can't forget that we have separate global epidemics associated with the metabolic syndrome, that is diabetes, high blood pressure, cholesterol issues, and thus an increased risk for heart attacks and strokes. And these have been global epidemics from before. In fact, the leading cause for death in the world is actually cardiovascular disease. So these chronic problems have been sometimes put into the back burner since March of this year as a result of the COVID-19 pandemic. And so if we think about it, increased body weight. So if you find that you're struggling with your weight as a result of obesity, think of it as a driver. And when you look in the rearview mirror, diabetes, high blood pressure, and those risks are in the back seat. Now, during the lockdowns, people were rightfully afraid about going to hospitals or health centers, perhaps to seek care, because of this fear of perhaps getting ill while waiting in the accident and emergency. So many persons stayed at home. So there was misconstrued advice saying to stay home, stay safe. However, they stayed at home with many of their chronic, poorly managed conditions. And coupled with that, there was a tendency to have poor diets and a sedentary lifestyle, once more perhaps as a result of fear of exercising. And we know that those remain the pillars when we're dealing with these chronic illnesses. Your meals rich in fruits, vegetables, peas and beans, low fat and low salt, and fish. And avoidance of a sedentary lifestyle for perhaps 30 to 60 minutes for most days in the week, whether you're running, walking, dancing, or Zumba in somewhere. And this has been a worldwide phenomenon, this fear of actually seeking care for your chronic medical problems since March, or since the start of the global epidemic, has been noted worldwide. And WHO has some striking data about the improper management of these chronic illnesses since the start of lockdowns. And our first slide shows that more than half of the countries in that survey, 53% of the countries, had partially or completely disrupted services for hypertension treatment. The CMO was speaking about the fact that hypertension seems to be a leading comorbidity when we're dealing with patients infected with COVID-19, and that has been seen worldwide. 49% of persons were struggling to get treatment for diabetes and its attendant problems, the eyes, the kidneys, the feet, and heart-related problems associated with the diabetes. And 42% of patients had delayed cancer treatment. So these are stats that looked at people who had delayed treatment during the lockdowns in March of this year. And 31% of persons actually stayed at home. So these are worldwide stats. 31% of people stayed at home with emergencies like strokes or heart attacks. So more than 50% of the countries in this study, according to the World Health Organization, reported postponement of public screening programs. And this is perhaps the most worrying aspect. The watchword is prevention when we're speaking about healthcare. And the month of October is Pinktober, as we try to increase awareness about breast cancer. And more than half of those countries reported postponement of public screening programs like mammograms or ultrasounds of the breast, and screening for cervical cancer. As we know, pap smears have been found to detect cancer of the neck of the womb early and also reduce mortality. So some striking stats there from that survey from the World Health Organization. And what we found at the same time is that these chronic illnesses increase the risk for severe infections. So apart from the fever, cough, or shortness of breath that would have been associated with most patients initially, at least with COVID-19, although we know it's a protein illness with multi-system features, so it may affect you from head to toe. Many patients with chronic problems like diabetes, high blood pressure, or heart disease have reduced levels of immunity, and that puts them at a risk for pneumonia, lung failure, and death. So septic shock and multi-organ failure. That's why we just thought that these slides, in terms of monitoring of your blood sugar, your blood pressure, and cholesterol would be important. One of the questions that we've been asked, what is normal? And a fasting blood sugar level of less than 100 would be normal. And you are deemed to be a pre-diabetic, just standing on the threshold of becoming a frank diabetic if you have fasting blood sugar levels of 100 to 125 milligrams per deciliter. So most of our labs would be using that unit of measurement, but some persons may have finger stick tests with the standard international units, millimoles per liter. And so if you've had a meal, 2 hours later, 140 to 199, pre-diabetes, and you'd be diagnosed with diabetes if you have a fasting blood sugar level that exceeds 126, and if you do a random test, the 2 hours after eating, a glucose level that exceeds 200. Next slide. Cholesterol, and we know that that is a potent risk factor for heart attacks and strokes. And total cholesterol, so it's a waxy substance that forms a vital part of our cells and hormones. However, the liver may overproduce, and we often see this in conjunction with increased body weight and diabetes. And a total level of under 200, so the finger stick tests are perhaps not as accurate. You would want to do a blood sample by your doctor or in the health center. And we know that when we're speaking about a lipid profile, it breaks down a good and bad type of fat. The good type levels more than 40 in men and more than 50 in women, and the so-called bad type, perhaps a good target would be under 100. So if you've had a heart attack or stroke, your goal may be even lower than that to lower the risk, perhaps under 70. There is another type of fat called triglycerides, and your goal at that point would be trying to keep that level under 150. Next. Now, high blood pressure is the single most important preventable cause of premature death. We're talking about damage to the eyes, the kidneys, the brain, the heart, the blood vessels to the legs, and it's known as a silent killer because very often there may be no symptoms. And based on what medical organization that you speak to, the normal ranges of blood pressure may vary. So it's the force of blood against the walls of arteries. Most of us may have home blood pressure kits to actually be monitoring the silent killer, and rightfully so. A normal level, the top number is called a systolic. That's when the heart contracts and pumps blood. A systolic pressure of under 120, and a diastolic, when the heart is relaxing, under 80 would be viewed as normal. Perhaps when that top number starts exceeding 130 or 140 and the lower number more than 90, you're thinking about having high blood pressure or hypertension. And indeed, we cannot stress the value of diet and exercise enough. Next. When we're speaking about someone with diabetes, so the first slide on blood sugar had spoken about the diagnosis of someone with high blood sugars. And the hemoglobin A1C is vitally important in a person who is a diabetic. It gives you a snapshot in how good your sugar level has been controlled for the preceding 3 months. And a normal level, or somebody who is a diabetic, you would be aiming to keep that level under 6.5 to 7%. Of course, one size doesn't fit all. An elderly, frail person with a limited life expectancy, you wouldn't want to be very tight with their blood sugars. because low levels have been found to increase the risk for heart attacks, strokes, rhythm abnormalities, and even death. So a younger person with a longer life expectancy who is fit and well, a hemoglobin A1C perhaps 7% would be a good target. And of course, you're trying to mitigate the risk of lowering the chance for blindness, for kidney failure, loss of limbs, and heart attacks and strokes. And having a tight control of your blood sugar early in the game perhaps affords you with a legacy effect. So years later, decades later, the chance of having a cardiovascular event would be lowered. So we know now that tight, aggressive control of blood sugar early on is absolutely essential in management. So it's a reminder here on this slide about a hemoglobin A1C that you're actually looking to target, and it's measured in terms of your blood sugar level, but a hemoglobin A1C is something that should be checked perhaps every 3 to 6 months to show just how good the control of your diabetes is, and it's something to chat with your physician about. So if I could just say too that we've been speaking about ways of relaxing the restrictions and lockdowns, and the 3 C's are vitally important when we're thinking about transmission of this novel virus called SARS-CoV-2. And those C's, you want to avoid close contact settings, crowded areas, and closed spaces. So I know that the chief medical officer had mentioned that so far locally, it seems that men and women have had similar frequencies in terms of infections with COVID-19 locally, but we have been seeing worldwide that men seem to be at a doubled risk for acquiring infection and even some of the complications. Now, there may be complex biopsychosocial reasons for this, and in fact, some of the researchers are actually going as far as saying that the XX chromosomes that women have may be affording some level of protection. So we know that men just have one X, so we would be XY. So it's thought that the XX may actually be protective. We know that men are more likely to smoke and are perhaps more likely to have risky behaviors. Some of them don't even want to wear their masks, and that, of course, may increase transmission. It would be remiss of me to not mention that many of these chronic illnesses have been associated, like increased body weight and diabetes, have been associated with a deficiency of vitamin D. And that has been very much on the front burner since the start of the COVID-19 pandemic. And it seems a bit of a paradox that people in the West Indies would have a low level of what is known as the sunshine vitamin. It's because our pigments, the melanin in our skin, hamper absorption of the sun's light. So those rays of light that would be involved with the activation and utilization of vitamin D. And we know that low levels of vitamin D affect immunity. And they have found that persons with lower levels are more likely to develop some of the life-threatening, potentially fatal complications of COVID-19. So it's something to probably have a chat to with your doctor, and as a public health message, especially if you're suffering from some of these chronic illnesses, to check your vitamin D levels to ensure that it would be replete, and thus perhaps increase the level of fighting off those soldiers to bolster someone's level of protection. Thank you.
Thank you very much, Dr. Tilak Singh, our colleague from the Southwest Regional Health Authority. And now Dr. Othello will get us up to date on COVID-19 and some of the mental health trends that we are seeing.
Good morning. Good morning, Dr. Parasram, Ms. Alcantara, Dr. Tilak Singh, members of the listening and viewing public, as well as members of the press present and participating virtually. Over the past months, we have been providing you with periodic updates on the importance of taking good care of your mental health, as well as steps that we can all take in order to maintain our mental health throughout the duration of the pandemic. Very early in the course of the COVID-19 pandemic, the Director General of the World Health Organization described the effects of the pandemic on people's mental health as being extremely worrying, adding that social isolation, fear of becoming infected, and loss of family members were being compounded by the distress caused by loss of both income and employment. As the pandemic progressed, anticipated adverse mental health outcomes began to be observed globally, and a number of researchers began to publish articles describing what they were observing in their geographic locations. Researchers at the University of the West Indies in St. Augustine have also begun conducting some research, and their results would be published in due time as their research is completed, and we all look forward to finding out those findings. However, I will now provide some data explaining what the mental health impact has been so far in some other countries since the onset of this pandemic. The British Office of National Statistics has noted a sharp elevation in the number of persons reporting high levels of anxiety at the beginning of the lockdown in response to this pandemic, compared to the last quarter of 2019. So they compared the end of 2019 with the beginning of 2020, when we were just starting to experience the pandemic, and they saw significantly higher levels of anxiety being reported. Although it dropped subsequently, average anxiety scores have remained elevated, and loneliness was significantly associated with higher anxiety scores. Morneau Shepell, an international private sector provider of digital mental health services, has also been conducting monthly mental health surveys for several years. This has enabled them to follow trends because they've been doing it for some time, so that when the pandemic began, they were able to look at the results that they were getting in April, May, June going forward and compare it to what the results they had from 2017, 2018, and 2019. They calculate something called the Mental Health Index. It's a numerical assessment of population mental health. And they were able to compare the mental health index for each month from April going forward with what was seen in the previous years. And they have been doing this for the United States, for Canada, for England, and for Australia. So I'll go to my first slide now. In the April report, Morneau Shepell reported the COVID-19 pandemic having some impact on the mental health of most Canadian responders, with the mental health index dropping 12 points to 63 compared to their benchmark of 75. So on the slide you could see a 0, and from the line where the 0 is, you see minus 12. That shows that the index was reduced by 12 points and in April compared to the previous years. A greater decrease in mental health was seen among persons who were not currently employed, females, and younger persons. A measure of the level of mental stress compared to the previous month, called the Mental Stress Change Score, was also recorded in April. And what was noted was that there was a greater increase in levels of stress for females than for males, that there was a greater increase in levels of stress for persons with 2 or more children compared with those who had no children, and that, interestingly, households with higher income recorded greater increases in stress than lower income households. Highlights from Canada's Mental Health Index report from April to August. Please go back to the previous slide. From April to August are seen in this slide, and you can see that on the left-hand side, as I said before, it shows the mental health index starting at minus 12 and starting to get better in June and July, but then starting to decrease again in the month of August. On the opposite side, you can see some of the indicators that they measured, and you can see that just as the total score was decreased by about 12 points, scores for anxiety and depression were also significantly reduced by in a similar range. Similarly, people's optimism was reduced, and you can see that having gone down to minus 12.7, and other features such as isolation show a similar trend. So on that slide, you see July being compared to August. And you can see that in August, it was even worse than in the month of July. The report noted that in the month of August, Canadians, especially young people, appeared to be suffering from what we're calling now COVID-19 fatigue, and this may have contributed to the decline seen in the month of August compared to the improvement that they were beginning to observe before that. We can go on to the next slide now. This slide looks at the mental stress change scores. And as you can see, for the 5th consecutive month, the mental stress change score reflected increased mental stress in the population overall compared to the prior month. So each month it is compared to the prior month, and you would see that in April, the score went from a baseline of 50 to a score of 74.7. And in each subsequent month, it was also increased. And again, you see in August, the magnitude of the increase starts to go up again. So the magnitude of the increase is going down, and then it starts to increase again in the month of August. Other findings were that, again, younger respondents continued to experience greater increase in mental stress, and females continued to have larger increases in stress than males. We can now go to the next slide. This slide shows the frequency with which emotions were reported, and as you can see, worry was the most commonly expressed emotion. You see, they looked at things like anger and frustration and worry, and then some positive ones like calm and gratitude and happiness. And worry was the one that was most frequently reported. A significant finding was that individuals who reported positive emotions such as calm and happiness and hopefulness, as well as gratitude, had much higher mental health index scores than individuals who reported negative emotions such as anger, disbelief, frustration, helplessness, and worry. So you see that the emotions that we're experiencing does have an impact on our mental health. It is noteworthy that although the absolute mental health index score varied among the countries studied, similar trends to those that we just saw for Canada were also observed in the United States, the United Kingdom, and Australia. The last public health crisis of this magnitude was the Spanish flu in 1918 to 1919. About 500 million persons, approximately 1/3 of the world's population, were infected, and approximately 50 million died. It is now known that the Spanish flu epidemic was associated with an increase in death by suicide, and it has been proposed that the decrease in social interaction, as well as fears caused by the pandemic, likely increased death by suicide. The next graphic, so we can change, this shows the various ways in which COVID-19 can contribute to elevated suicide risk. As you can observe, stressful factors such as fear, uncertainty, and social isolation, as you see in the first box, and as well as economic difficulties, can be associated with increased vulnerability in a population. Persons who experience these things and also have other vulnerabilities such as pre-existing psychiatric disorders, poor coping skills, low resilience, and persons with persons in areas where there's a high prevalence of COVID-19, or persons who have lost loved ones to COVID-19, are also at an increased level of vulnerability. So such persons, having experienced these stresses, can be at increased risk for adverse outcomes. And you see some of the adverse outcomes listed there, and they can range from worsening of pre-existing psychiatric conditions to development of depressive disorders, development of anxiety disorders, development of alcohol and other substance misuse disorders, as well as other psychiatric conditions. And any of these conditions can, in certain circumstances, lead to increased risk for death by suicide. Therefore, once again, as I stated on World Suicide Awareness Day, let us be reminded that we must take care to ensure that persons who need mental health services, who need any level of mental health care, receive the care that they need in a timely manner to reduce the risk for negative outcomes, and in particular, to reduce the risk for the outcome of suicide. Thank you for your attention.
Thank you very much, Dr. Othello. And next we go into the question and answer segment. We ask our media representatives, please state your name and the name of the media house that you represent before asking your question. And we begin with 98.1 this morning. Sorry, Mr. Cummings, we can't hear you. Just check on your levels. I think we may be ready for Mr. Cummings at this time.
Yes, good.
Wonderful. Good morning.
And of course, Ms. Alcantara, thank you so much again for accommodating my two questions, one for Dr. Tello and the other for Dr. Parasuram. I'll start with Dr. Tello. Dr. Tello, you went into some statistics there, and as a matter of fact, I wanted to ask a question on that relative to where we are in terms of our data collection. And you mentioned that there is a study that's happening now that we hopefully will get some results very soon. But I'm more concerned about the long-term impact on mental health. Yes, we are talking COVID-19, but is there a plan that you know of that is being devised now to treat with the long-term aspect of COVID-19? We're going through the period now, yes, but I'm wondering if you can talk to us about what is, on the horizon. What do you see as on the horizon? And Dr. Parasuram, as our monitoring and evaluation continue, there was a promise to have more pulse oximeters for home quarantine positive patients. Have those been collected and or distributed sufficiently in the required numbers? Thank you.
Yeah, so let me just go quickly and then Dr. Othello can go into some detail. So yes, the additional 4,000 pulse oximeters have been received by the ministry, and the process during the course of this week, we are trying to ensure that everyone, all of the active cases, have one pulse oximeter in each household. So hopefully by the end of the week, everyone that is active can have those pieces of equipment at home and be using them as a clinical tool to measure your oxygen and your pulse. So that should be out by the end of the week. As you know, as we get new cases, we will try to disseminate those as quickly as they come through the CMOH offices. Dr. Othello?
Okay, thank you for your question. The Mental Health Unit in the Ministry of Health is in constant collaboration with the heads of the psychiatric departments within the various regional health authorities. From the onset of the pandemic, we were aware that a mental health response would be required, and we have been liaising with them to ensure that that response is being provided. We have also been aware that certain long-term sequelae or long-term adverse mental health outcomes are to be expected, and the World Health Organization has published numerous guidelines in that regard, so that we are in fact looking at our mental health services from that perspective. And the interesting thing, or the beneficial thing, is that the pandemic occurred at the time where we were already planning to ramp up services as part of our decentralization of mental health services, so that the aim of that decentralization plan is to increase the access to service at the community level so that people could receive service near to where they live. And that's the best way to respond to the long-term effects of this pandemic, to make sure that people who develop mental health disorders during the months and even perhaps years to come can access the services that they need close to where they live.
Thank you very much, CMO and Dr. Othello. And we move now to I-95.5, please.
Good morning to everyone at the head table. Whitfield in I-95.5. Dr. Othello, just to follow on from Stephen's question, I know you mentioned the ongoing UE study, but from your own personal interactions and experiences, what increases in mental health disorders have you been able to detect so far since the beginning of the pandemic? And how concerned are you about the negative impact on mental health as it pertains to the prolonged use of the physical distancing protocol? And my second question, most likely for CMO, persons have started to complain about headaches that they believe to be linked to prolonged use of digital devices for e-learning and so forth. Any advice for those persons on how they can safely use these devices without any negative physical fallout?
Okay, Dr. Tam.
Okay, thank you for your question. With respect to clinical trends, yes, in clinical practice, I have observed increased levels of anxiety disorders as well as depressive disorders. So that's anecdotal at this stage because I haven't compared the number of persons I saw during the same period last year with this period. But from an anecdotal point of view, there does appear to be more anxiety and more depressive disorder, as well as increased levels of suicidal thinking and all that goes with that, so that we have been having to manage those situations and provide persons with the care that they need in order to reduce the risk for negative outcomes. And from what I've been hearing from colleagues, other persons have in the clinics across the country have been experiencing similar findings. With respect to the emotional outcome of physical distancing, again, it's another contributor to the types of long-term problems that WHO and other authorities have been telling us to expect. We try to counteract that by continuing to provide advice about ways that we can remain in touch with our loved ones, even though we can't be physically close to them. I keep reminding people I have not hugged my parents since March, but I go to their house and I wave from by the gate, or they're upstairs and I talk to them from downstairs in the yard. I make sure they're all right. I talk to them regularly on the phone. My sister who is abroad talks to them with video calling so she can see them. And those are the types of things that we have to do so that we maintain connectivity with our loved ones. And let us please continue to emphasize physical distancing rather than social distancing.
Okay, so Mr. Turner, regarding, so you're saying persons saying they have headaches related to e-learning. So I would be a little cautious in trying to take that symptom, which is headaches, and attribute it to a particular cause. So what I would suggest is that if you are having persistent headaches related to whatever it may be, that you seek medical attention to determine the cause of it, see where the link is. But by general way of e-learning and using any sort of tablet or device, we of course try to limit that exposure to short sessions, having breaks in between. Of course, using there's a feature in it for blue light. You could use that feature for e-learning as well. But the main thing is not to try to attribute the headaches to necessarily using that piece of equipment. We need you to be assessed by a physician to determine the cause.
Thank you very much. And we go now to TV6, please.
Good morning, Elizabeth Williams, TV6 News. My question is directed to Dr. Parasram. I don't know if you can answer. I know there was the recent lifting of measures for Tobago in terms of Buku Reef and environs. I would like to know if you are considering, because I know you would, in terms of measures, you would address the government or sometimes give your opinions. Are you looking at Tobago, or would you care to look at Tobago as a test case for Trinidad and Tobago in terms of easing up of the measures of the lockdown for all businesses to reopen? Are you looking at that as making Tobago a test case for the country? And in terms of reef tour operators still having limited use of the beach, are you looking at reopening beaches at times, in example, from 8 a.m. to 4 p.m. Is this being looked at? And I know, Dr. Otello, you would have stated figures with respect to Canada and mental health issues. In terms of Trinidad and Tobago, do you have any sort of information that you can give us in terms of the hotlines and the monitoring of the hotlines at this time, cases with respect to mental health that you have observed?
Okay, so in terms of your first question, no part of the country, whether it be Tobago or any of the counties we spoke about, will be used as a test case, because what we are implying is that we will use up an area and see if the cases rise, and of course if the cases rise there will be an increased number of deaths. So no part of the country will be used as a test case. Trinidad and Tobago is one country. We treat our public health regulations are driven by public health guidance as well as other factors, which the Honorable Prime Minister will always take into consideration prior to making those ultimate decisions. Dr. Otello?
Thank you for your question, Ms. Williams, but unfortunately I don't have the data from the hotlines at my disposal at this moment. My apologies.
Okay, thank you very much. And we go to CNC3, please.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. CMO, before I ask my question, I just want to clarify one thing, right? In the earlier presentation, when you were speaking about comorbidities and stuff, that 48% that we saw, was that of all the total cases that we've had, 48% had comorbidities?
Right, so this was a point. So in one of the graphs I showed 48.5% with comorbidities. That was related to a particular point in time a couple of days ago. Did not include a couple of counties which we didn't have the complete data set at the time, which is St. George Central, St. Patrick, and St. Andrew, St. David. So that is what it would have been representative of at the point in time.
Okay, all right, thank you very much. So my question then is, these are the groups of people who we would expect to take extra precautions or to be protected or protecting themselves by their family, however, from contracting COVID-19, because it is a risk factor for death with the infection. So why is it that we're seeing so many or such a large chunk of people having comorbidities? Is it that it's just because of the prevalence of comorbidities within our population?
Sure. So in Trinidad and Tobago, the last available data set I have, 17% roughly of the population has diabetes in terms of prevalence, 23% hypertension, 17% cancers, and I believe it's 9% roughly have CVAs, cerebrovascular accidents, which is a fairly large group of people. When you add all of them together, there's a lot of correlation between hypertension, people having hypertension and diabetes at the same time. So if you have a population with that large burden of diabetes or hypertension, whatever it may be, as a comorbid base, of course, based on the of infection that you get, it will be extremely difficult to isolate these people completely as a separate group. Hence the reason I believe that we have infections in those groups. But we are asking, as Dr. Tiloksing would have spoken, that those persons, knowing your particular situation, be extra cautious, take the preventative measures, the public health measures in place to avoid yourself getting infected. And of course, if you have relatives that have these comorbid features, it augurs very well that you take extra caution to expose those individuals.
Okay, thank you very much, and we'll try to get as many questions in as possible. We go to AZP News for 2 brief questions, please.
Hi, good morning. Priya Bihari, azpnews.com. My first question is for the CMO. CMO, there are a number of cases we have heard that when someone tests positive, he is given a quarantine order to stay at home. His relatives are also told to stay at home, but they have no order. And when they are waiting the results, there are reports that they go out and they don't self-isolate. That is an issue. I don't know if you know about it and if you're aware of it and what can be done. And my second question is for Dr. Otello. Dr. Otello, the issue of Trinidad and Tobago nationals stranded in the UK was raised in UK Parliament yesterday by MP Steve Baker. And one of the issues, he said that the nationals were terrified of failing to get home. Is there any advice you have for them, but not only the nationals stranded in UK, but across the world? What can they do, to help them with this sense of anxiety they may have right now? Thank you.
Okay, yes, we had a few cases in between where persons, the entire household, weren't given the quarantine order. The primary case would have been given their quarantine order or the primary exposure. So we are aware of it. The entire household should be quarantined together to avoid any spread. So we have been working very closely with the TTPS to ensure that and the CMOHs, that a quarantine order is given to everyone in the household. Of course, in terms of children, there's a different way to deal with that particular scenario. And the TTPS will be following up once they know who has the quarantine orders, of course, to do their calling and checking on those people to ensure that they stay at home. Dr. Otello?
Dr. Otello?
Yes.
Yeah.
With respect to, I think your question was what advice I would give to persons who are becoming increasingly anxious because they're stranded abroad somewhere and can't return home. Well, I mean, the management of anxiety is the same regardless of what the cause of the anxiety is. So that if that anxiety is at a level where you really, really cannot cope, you may need to access mental health services wherever you are. However, if it's a lower level of anxiety, then there are things that work really well, such as breathing exercises, and there are apps you could find that assist with those things these days thanks to technology. So there are lots of easy ways that you could find that to reduce your anxiety in that moment when you are particularly anxious. However, as a more general rule, I would advise that you take things one day at a time, knowing that the situation is being worked out. It may not be working out as fast as you would like, but take things one day at a time and live each day in that day. Don't worry about tomorrow and the next day and the next day. Each day, do the best you can do that day and start again at the beginning of the next day.
Thank you, Dr. Othello. And we move to TTT, please.
Good morning, everyone. My question to Othello, Crystal Wilson, TTT Limited. A report coming out of Tobago just yesterday during their COVID-19 updates spoke of a decline in the mental health of medical staff. Are you able to speak to those on the front line here in Trinidad? How have they been coping, and what are some of the coping mechanisms that you'll advise doctors to use? Thank you.
Okay, with respect to the mental health of doctors and other frontline workers, we have advised in the past that you manage yourselves in terms of your hours. You have shifts to work, but make sure you get enough rest, make sure you eat properly, make sure that you exercise. In other words, take care of yourself as a whole person. Work takes up a substantial number of hours for many of us, and particularly so for frontline workers. But you have to take care of your health. In addition to that, stay in contact with loved ones and speak to your co-workers and if necessary, to your supervisors if you're not having difficulty coping.
Yes,
Thank you very much.
Ms. Alcantara, just to correct some information, in terms of the hypertension, the prevalence was 9%, the cardiovascular disease was 23%.
Okay, thank you very much, CMO, for that clarification. We move now to Newsday, please.
Hi, good morning. Paula Lindo here from the Newsday. So I have two questions, one for Dr. Tiloksing and one for the CMO. Dr. Tiloksing, could you tell us, you spoke about people being at home, having sedentary lifestyles. Could you tell us if there has been a spike in NCD-related ailments that have been reported to the various health centers, etc., since the start of the pandemic? And to the CMO, could you tell me the number of spaces available in state quarantine, since we are expecting to increase the number of returning nationals? Thank you.
Okay. Thank you. We go to Dr. Tiloksing for a response to the first question, please.
Thank you, Ms. Lindo. And I think it's a very insightful question, since we've been speaking about separate epidemics of these chronic problems like high blood pressures, high blood sugars, increased weight, and the watchword is prevention. We've been speaking about the value of exercise, but persons were rightfully afraid of actually venturing outside at that point, especially in a crowded environment. If you're by yourself, it may be different. And at least 30 to 60 minutes for most days in the week. So as a result of this lack of exercise and an increased sedentary lifestyle, as well as poor diets, we found that there was certainly not just an increased risk, not just an increased risk of admissions to health centers with these problems, but also a spike in admissions to emergency departments for uncontrolled chronic problems. So high blood sugars, high blood pressures, and even some of the potentially life-threatening problems like strokes and heart attacks. Whether or not it's purely due to the increased incidence of a sedentary lifestyle, or whether it was due to something more like the stressors associated, we know that there is such a strong link with stress, as we heard from Dr. Othello, and the physical body, and or a poor diet or not using some medications, that would be certainly increasing one's risk for admission to hospital. Thank you.
Yeah, in terms of the quarantine facilities, it varies a little bit between 350 and 400 rooms. Sometimes if you have positive cases in particular facilities, they need some time before you bring the other cohort in. So there's variance somewhere between 350 and 400 at any given time.
Thank you very much, everyone. We have come to the end of this morning's media conference. Please remember that the same new normal guidelines help prevent the spread of COVID-19 and also help prevent the spread of the flu. Follow the guidelines, get the flu vaccine, and please wear your mask.
COVID-19 is here and has become everyone's business. It's not a respecter of age, race, gender, one's financial, educational status, or mental and physical ability. Therefore, it is our duty to prevent the spread of this virus in our communities. We all have a part to play with this pandemic. Therefore, there's so many things we can do. First of all, we can wear our mask, practice good hand hygiene, that is washing your hands and hand sanitizing, as well as maintaining the social distancing at least 6 feet apart. Added to that, you can eat well, rest well, hydrate well. Ensure that you maintain your immune boosters by taking multivitamins. We, the frontline healthcare workers, need you to help us with this fight. To those suffering with predisposed and health conditions like asthma, diabetes, hypertension, renal disease, autoimmune disease, just to name a few, take your medications as recommended by your health physician. Families, friends, I urge you to ensure that their supply is adequate. Do not let it finish. Also, take your recommended diet as per health condition. Do not cheat, for to cheat means you put your body in a difficulty to cope. To those persons living with depression, other health and mental health and emotional health conditions, self-quarantine is a difficult time. We know and understand this. I urge families and loved ones, do check up on them regularly. Send a voice note, make a phone call, extend your love, care, and support to them as they do need your care and support at this time. To the youth of Trinidad and Tobago, do not think for 1 minute that you are exempted from this virus. I urge you to encourage good behavior amongst your peers. Do exercise good health practice, and also ensure that you exercise the preventative health measures in this pandemic implemented for your benefit. I must add, in support of my health colleagues, we are committed to ensuring that you receive the delivery of care that is necessary to aid a speedy recovery for those who end up with this virus. Do act responsibly. Ensure that you maintain good health practices. Protect yourself, and in so doing, protect your loved ones. For prevention is so much better than cure.
National shutdowns due to COVID-19 have led to families